Speaker. I rise today in support of H.R. 1215, the Protecting Access to Care Act of 2017, a much-needed piece of legislation aimed at reforming medical malpractice law in order to help drive cost to providing health care and thereby making it more affordable for all Americans. I had the privilege of practicing medicine in the great state of Tennessee for 31 years before coming to Congress. And the one thing that took away some of the joy from that practice was the threat of frivolous lawsuits. Because of trial attorneys, over the years, the premiums for malpractice insurance have ballooned to levels that make it difficult for providers to practice and are driving more people out of practice, away from small practices and into large hospital systems, just so they can survive as a practitioner. Worse still, the jury awards aren't going to the victims of actual malpractice. In Tennessee, prior to implementing some malpractice reforms, over half of the premium dollars were paid out to attorneys. Less than 40 cents of every dollar paid out have gone to people who have actually been injured, so we are not compensating the injured party. Thankfully, states like my home state of Tennessee are taking action and have enacted much-needed reforms in the last decade, and the costs associated with providing care have plummeted since then. In 2008, the Tennessee Medical Malpractice Act was signed into law and created requirements that the plaintiff in a health care liability action provide the defendant with a pre-suit notice of the claim, as well as a qualified expert to review the case and certify that it has merit. Adding on to these reforms, in 2011, Tennessee Civil Justice Act was signed into law. It included a $750,000 cap for non-economic damages and a cap on punitive damages at greater than twice the compensatory damages, or $500,000. With these changes between 2008 and 2014, the number of medical malpractice lawsuits in Tennessee decreased by 36% from 584 to just 374. And Mr. Speaker, between 2009 and 2014, medical malpractice premium for an OBGYN doctor like myself decreased from $52,000 plus to $33,000, nearly a $20,000 decrease in premiums per year. Those of us who were here in 2009 when the Affordable Care Act was debated remember that President Obama acknowledged that the cost of defensive medicine was a bipartisan concern and something that he wanted to address. But despite the fact of our legislation is modeled on a California law that has stood the test for 40 years through both Republican and Democratic governors, Democrats have made no serious attempt to address medical malpractice as their health care bill was pushed through, which is yet another flaw of the ACA. Today's bill is common sense. With these reforms, we will ensure patients, not trial attorneys, are compensated for legitimate malpractice claims, and there are legitimate claims out there. But we will also prevent frivolous litigation from moving forward. For those concerned about the 10th Amendment, this bill respects states' rights and only subjects claims with a federal nexus to this law, while giving a great deal of latitude to states to act in their own accord. Mr. Speaker, I loved what I did while I was in practice. I had the chance to deliver about 5,000 babies, and it never felt like a job. It's just what I did and enjoyed doing. But at a time when healthcare costs are spiraling out of control, an easy fix like H.R. 1215 just makes sense. And there's just another piece of the puzzle to help the costs of health care go down. I strongly support the much-needed reforms in this legislation. I urge my colleagues to vote in favor of final passage. And one final thing, Mr. Speaker, I have a list here of our premiums in the state of Tennessee, and under every specialty listed here, and there are numerous, there were dramatic decreases in each of these. With that, I yield back.